Hello, I am Dr. Courtney Thornburg, a pediatric hematologist at Rady Children's Hospital, San Diego, and UC San Diego. I am talking about an abstract entitled A New Gene Editing Lexicon Strategy for the Haemophilia Community. This abstract was presented by Hermans and colleagues. The abstract describes a collaboration between industry, Molansky and Partners, which is a language strategy company, and clinicians in the U.S. and Europe to describe our approach to developing a novel gene editing lexicon. The authors identified a need to have standardized language, or lexicon, to talk about gene therapy, and recognized the importance of including lived experience experts, including people living with hemophilia and their families and loved ones, for the lexicon development. The benefits of a standardized lexicon are to enable effective communication of complex scientific concepts and treatment considerations, create accuracy and consistency in content development, build trust and partnership across stakeholders, resolve conflicts over terminology, and reduce the risk of misinformation. The main objective is to develop a lexicon which is informed by the hemophilia community and is inclusive, scientifically accurate, and reassuring while avoiding overpromising or highly technical terminology. Participants in this development included a lexicon steering committee representing major organizations in the hemophilia and gene editing communities, and research participants including healthcare providers, lived experience expert persons with hemophilia, and caregivers. The lexicon development process involved a multi-step approach. First, there were in-depth interviews and discussions of the Lexicon Steering Committee to understand the challenges, uncover key questions, and identify potential framing and messaging approaches for the lexicon. Second, the Language Strategy Company analyzed the language of gene therapy and gene editing in hemophilia on the websites of the National Bleeding Disorders Foundation, the World Federation of Hemophilia, EHC, and ISTH. Third, the Language Strategy Company conducted a language lab with the steering committee to review the language to be tested. Fourth, the language which explains gene editing for hemophilia to be tested was defined. Fifth, qualitative research was conducted with the lived experience experts and hematologists in the US, the UK, and Germany. Then the qualitative research data were reviewed by the Lexicon Steering Committee, and finally, the language recommendations for the gene editing lexicon were finalized. The lexicon will be implemented to support patient engagement and education, informed consents, and scientific publications and communication of data. Thank you very much.